If your knee aches at the front or the inner side when you walk downstairs, and squatting or rising from a chair makes it hurt, that can be an early sign of knee osteoarthritis, the gradual wear and loss of the cartilage that cushions your knee. The good news is that it usually develops slowly, and matching your care to the stage you're at really does make a difference. In the next few minutes I'll walk you through the typical symptoms and X-ray stages, a quick self-check you can do at home, how this differs from rheumatoid arthritis and a torn meniscus, what genuinely helps day to day, and the warning signs that mean you should be seen right away. So what's actually happening inside the joint? The ends of the bones in your knee are capped with smooth, slippery articular cartilage that lets the joint glide almost without friction. Osteoarthritis is the gradual breakdown of that cartilage over time, and it's the most common form of knee arthritis. As the cartilage thins, the gap between the bones narrows, the bone underneath hardens, and small bone spurs form around the edges. When the wear is concentrated on the inner side, the leg can slowly bow outward over the years. Common risk factors include age, usually after about 50, a previous knee injury, overuse, and carrying extra body weight. Here's the part worth understanding. Cartilage. Osteoarthritis pain has a telltale rhythm. It gets worse with activity and weight bearing, and it eases with rest. Classic clues include pain going downstairs, which loads the kneecap at roughly 3.5 times your body weight. Pain when you squat or get up from sitting, stiffness and swelling after walking, and a grinding or clicking sensation called crepitus. Morning stiffness is usually brief, loosening up within about half an hour. That short stiffness is a useful clue, because in rheumatoid arthritis it tends to last more than an hour. On X-ray, doctors grade severity using the Kellgren-Lawrence system, from grade 0 through grade 4, which at its most severe looks like bone on bone. But remember, the Not all knee pain is osteoarthritis, and a few conditions look similar but are treated very differently. Here's a simple way to tell them apart. With osteoarthritis, the more you move it the worse it gets, and rest helps. It often affects one knee. You may feel crepitus, and the leg can take on a bow-legged shape. Rheumatoid arthritis is an autoimmune condition, so it tends to hit small joints symmetrically, comes with long morning stiffness over an hour, and brings whole body symptoms like fatigue and low-grade fever. A meniscus tear usually follows a specific twist on a planted leg, and the knee may lock, catch, or give way, sometimes with a pop and swelling that takes about a day to appear. Gout can flare suddenly with a hole. Now, what actually helps? The core idea is to reduce the load on the knee and strengthen the muscles that support it. Losing weight is one of the most powerful things you can do, because each pound of body weight adds about 4 pounds of load across the knee, and losing at least 5% of your weight improves knee function. Exercise is the best supported treatment. Building the quadriceps with quad sets and gentle wall squats shares the load, and low-impact activity like walking on level ground, swimming, and stationary cycling is ideal. It's wise to limit deep squats, downhill hiking, running, and pivoting sports. For symptoms, clinicians may use anti-inflammatory medication or acetaminophen, and options like cortisone injections, and surgery is considered when conservative. Before we finish, here are the red flags that need prompt attention, because they may not be ordinary wear and tear. A hot, red, very swollen knee with severe pain at rest, often with a fever, can mean an infected joint, which is an emergency. A joint that suddenly turns intensely painful and red could be gout, or that same infection. After a fall or twist, a knee that locks, won't straighten, or gives way can signal a meniscus or ligament injury. And unexplained weight loss, or pain that's consistently worse at night, deserves a check. Don't write these off as just arthritis. So to recap, activity-related front or inner knee pain that eases with rest suggests osteoarthritis. Weight control and quad strengthening are